Hi, come in. Go ahead and have a seat up on the examination chair there. Oh, don't worry, take your time. There's no rush. It's good to see you again. So, this is just your routine follow up appointment. We're about 1 to 2 weeks out from your surgery now. So, today is just simply about checking the progress and making sure your healing is steady. There's nothing urgent, nothing dramatic, just a proper check. But before we begin, I want to ask, how have you been feeling overall? Okay. Mhm. Yeah, a little tired, some soreness, stiffness when you wake up. Okay. Yeah, that all sounds honestly appropriate for this sort of stage. Nothing to worry about. Any fever, sharp worsening pains, or any spreading redness, rashes? No? Good. Well, that's reassuring already. Right, so I'm just going to sanitize my hands. Just put some alcohol gel on and some gloves to be safe to protect you. All right, let's start with your vitals before we look at the surgical site. First, just sit normally and breathe naturally. In and out, like this, just gently. Okay, your breathing looks even. Your shoulders aren't guarded too tightly, which usually tells me the pain is manageable. You don't look distressed. That's a positive sign. Okay, so let me listen to your heart. Sorry, the stethoscope may feel a bit cold. Is that all right? Good. Okay, so again, deep breath in and out. Again, in and out. Good. Yeah, your heart rhythm seems steady. No irregular beats, no stress elevation. Okay, now your lungs. Breathe in again slowly and out. Yeah, your lungs sound perfect to me, and your breathing is still relaxed. So that's good news. It tells me that your body's not under any sort of strain or fighting off anything. Okay, so now just check your blood pressure. I'm going to place the cuff on your arm, so you'll feel a steady squeeze. It does feel like it gets quite tight, but that's just normal. Okay, so inflating now. Just hold on. And there you go, it's releasing now. Right, so let me just check the results. Wow, yeah, your blood pressure is within a nice healthy range. That's exactly what I want to see at this stage of recovery. Stable vitals means that your body is adjusting very well. Okay then. Right, now let's look at that surgical area where you had the surgery. I know this is going to be a bit discomforting, but I'll be gentle. But if you feel discomfort, just say so. You don't need to tolerate anything unnecessary. Okay. Right, first I'll observe it. Okay, the incision edges look very clean. The surgery did go well. There is mild swelling, but that's expected. That's just your body reacting to some light discoloration, again, also expected. Your body's basically been through trauma, so it's just doing the natural responses, but it should get better over time. And there's no excessive warmth or the redness spreading around, so that's right. I'm just going to apply some very light pressure. Sorry, is that tender? Hmm, not too bad. Okay. Well, that level is normal. It's responsive but not too sharp. That tells me the inflammation is controlled. Okay, the tissue feels like it's beginning to strengthen as well. Yep, you're healing properly. No issues here. Okay, so just to make you feel more at ease, if you don't already, so listen to me carefully, okay? I don't want to make you anxious. Everything I'm seeing today lines up with normal recovery. You're fine. You're not behind. You're not healing poorly. You are right on schedule. Trust me. Sometimes when you're inside the body, it feels more dramatic. You've gone through a big traumatic event, a lot of changes that you're not used to, sorenesses, your skin's different. But from outside, from a clinical perspective, this is steady healing. So honestly, don't worry. But if you do have any questions during this or afterwards, feel free to talk to me or contact me and I'll see if I can help. Okay, so just to let you know as well, um, as I've said a lot recently, that your body has been through trauma. So your body will now go into like repair mode. So this means increased blood flow to the area, which I've seen, controlled inflammation, new tissue forming beneath the surface, and your nerve endings are also gradually getting used to everything and recalibrating because I've had a massive shock. So you may feel small twinges, occasional tightness, and random mild aches. That's just a sign of rebuilding. It's just your nerves firing off again and figuring out what's been going on. It's not damage. And obviously, fatigue is also common. Your immune system and repair processes both use a lot of energy. Healing is work, so feeling slightly slower right now, or you don't feel as good as you thought, it doesn't mean something's wrong. It just means your body is prioritizing healing over activity or anything else. Right, so I'll just look at the stitches. You may feel a slight pulling sensation. That's all. Okay, first one. Good. Second one. Yep, you're doing really well. You're staying relaxed. That helps. Third one. There we go. And that's it. Okay, I'll place small adhesive strips for surface support. There we go. Clean, secured, and simple. Okay, so you're doing really well. Just take a breath in with me. In and out. It's okay. You're stable. Your body's functioning normally. This appointment is just confirmation. I'm not going to intervene any more than I have to. I'm just here to make sure you're on the correct path. So let your nervous system register that you're doing okay. Okay, so let me just go over some things people often worry about after this surgery. Is this tight feeling normal? Definitely. Tissue remodeling causes stiffness, so gentle movement improves it. And if you're worried why the area looks darker than you thought, it's because scar tissue can appear more pronounced before it softens. If you still feel tired, as I said, that's probably understandable and it can last a few weeks, but it will improve. But again, the soreness is normal, and if you move the wrong way, you won't just do normal daily movements, but please don't try and lift anything or put any strain on your body. Recovery is about the direction you're going, not perfection. So, and you're definitely improving. So just let your body do the rest. Okay, so just going to palpate once more lightly. Okay, still safe. Edge is intact. Fluid build. Concerning signs. Just okay. Yeah, again, I'm comfortable with your progress. Very comfortable. Okay, let me just write this down. Okay, so incision clean, suture, vitals stable, progress. Yeah, everything's fine. Okay, right. Okay, that's a pretty good summary of everything. Okay, I'll just do one final examination all over you to make sure I've got everything and I can put it all in your notes. Okay, yes. Yeah, I'm definitely satisfied. Everything aligns with what we know about appropriate healing at 1 to 2 weeks. No red flags, no complications, no concerns. Right, so I won't take up any more of your time. You handled surgery really well, you've handled recovery well, and today confirms that. We'll schedule another routine check in a few weeks. Yeah, sounds good. But I expect continued improvement. Honestly, you're healing well. Take your time getting up. Move slowly, no rush. You're stable. And you're doing better than you think. I'll see you at the next follow up. Goodbye.